The family meeting was called for Sunday dinner at my parents' house, with the kind of formal invitation that usually meant someone was getting married, divorced, or had received life-changing medical news. What I didn't expect was to watch my parents hand my 32-year-old brother a check for $100,000 to help him get back on his feet, while explaining that my request for a business loan had been denied because I was too ambitious for my own good. My name is Dr. Alexandra Martinez, and for 8 years, I'd been building a successful medical practice while watching my family enable my brother Tony's pattern of failed ventures, abandoned responsibilities, and financial disasters that somehow always required bailouts from our parents' retirement savings. What my family had forgotten when they decided I was too ambitious to deserve support was that I wasn't just their daughter asking for help. I was a physician who understood exactly how family dynamics could be systematically poisoned by favoritism and financial manipulation. Their $100,000 investment in Tony's latest failure was about to become the catalyst for demonstrating what real ambition could accomplish when properly motivated. My parents thought they were protecting their son while teaching their daughter a lesson about knowing her place. What they were actually doing was providing a successful medical professional with perfect motivation to show them exactly what happened when you bet against someone who'd spent a decade proving that ambition and competence could overcome any obstacle. Picture this. The same dining room where I'd announced my acceptance to medical school, celebrated graduating with honors, and shared news about establishing my own practice. The Martinez family had gathered for what my mother called an important family discussion about supporting each other through challenging times. Tony sat at his usual place at the table, looking like a man approaching middle age who'd never quite figured out how to be an adult. His latest business venture, a food truck specializing in artisanal fusion tacos, had failed spectacularly after 6 months, leaving him $80,000 in debt and facing bankruptcy. Tony's been going through a rough patch, but he's learned from his mistakes. This new opportunity in real estate development could really be his breakthrough if he has the right support. We've decided to help Tony with a fresh start. $100,000 should be enough to pay off his debts and give him capital to invest in this property development course he's excited about. I watched my parents hand Tony a check that represented 2 years of their retirement savings, presented with the kind of ceremony usually reserved for graduation gifts or wedding contributions. Tony accepted it with the casual entitlement of someone who'd been bailed out so many times that financial rescue had become an expected family service. This was the same Tony who'd dropped out of college twice, quit 7 jobs in 5 years, and had been living in our parents' basement for the past 18 months while pursuing various entrepreneurial opportunities that consistently failed due to what he called market conditions beyond his control. Now, Alexandra, my father continued, we know you've been asking about a loan for expanding your practice, but we need to discuss some concerns about your approach to business and family priorities. My approach to business? Sweetheart, you've become so focused on career advancement that you're forgetting what's really important. You're 34 years old, unmarried, working 60-hour weeks. Maybe instead of expanding your practice, you should be focusing on finding a good husband and starting a family. What followed was a 20-minute lecture about how my ambition was unnatural for a woman my age, how my success was making me intimidating to potential partners, and how investing in my practice expansion would only encourage more unhealthy prioritization of career over family. Tony needs this help because he's trying to build something that will support a future family. You already have a stable income, Alexandra. Your mother and I think you're too ambitious for your own good. You need to learn that there are more important things than professional achievement. I sat in stunned silence, processing the fact that my parents had just handed my chronically failing brother $100,000 while explaining that my successful medical practice made me unworthy of support because ambition was apparently a character flaw in daughters, but an entrepreneurial virtue in sons. The meeting ended with Tony thanking our parents for believing in his potential, while they advised me to consider what really matters and maybe join a church group or volunteer organization where you might meet a nice man who isn't threatened by successful women. That evening, driving home from my parents' house, I understood something profound about family dynamics and gender expectations. Tony's repeated failures were treated as temporary setbacks requiring investment and support. My sustained success was treated as a problem requiring correction and redirection. But what my family had failed to consider was that they'd just provided a motivated physician with perfect inspiration to demonstrate exactly what too ambitious could accomplish when channeled toward proving them catastrophically wrong about their investment choices. Monday morning found me in my medical office, reviewing patient charts while processing the family dinner revelation with the same analytical approach I applied to complex medical cases. My parents' financial decision wasn't just misguided favoritism, it was a symptom of systematic dysfunction that required comprehensive evaluation. I'd spent the weekend researching Tony's business history with the thoroughness I applied to patient diagnosis. His pattern of failure wasn't random bad luck. It was predictable outcome of poor planning, inadequate research, and unrealistic expectations enabled by family bailouts that prevented him from learning from consequences. The food truck failure had been entirely avoidable. Tony had never researched local licensing requirements, health department regulations, or basic financial planning that would have revealed his business model was unsustainable from the start. When reality conflicted with his expectations, he'd simply abandoned the venture and expected our parents to absorb the financial consequences. This pattern repeated across every business opportunity Tony had pursued over the past decade. The landscaping company that failed because he'd never learned to manage employees. The online retail venture that collapsed because he'd ignored inventory management and customer service. The construction business that ended when he'd discovered manual labor was harder than he'd expected. Each failure had been followed by our parents' financial rescue, accompanied by explanations about learning experiences and character building that justified continued investment in someone who'd never demonstrated capacity for sustained effort or business competence. Meanwhile, my medical practice was achieving exactly the kind of success that my parents claimed made me too ambitious. I'd built a patient base of over 2,000 people, maintained hospital privileges at 3 facilities, and established a reputation for diagnostic accuracy that attracted referrals from colleagues throughout the region. The practice expansion I'd requested funding for wasn't ambitious fantasy. It was strategic growth based on documented demand, comprehensive financial planning, and proven track record of success. I'd presented my parents with business plans, financial projections, and market analysis that would have impressed any legitimate investor. But their response to my success had been concern rather than pride, criticism rather than support. My achievements were treated as evidence of misplaced priorities rather than demonstration of competence and work ethic that should have earned confidence in my business judgment. That's when I understood exactly how to respond to my family's $100,000 investment in Tony's latest failure, while teaching them the difference between real ambition and entitled incompetence. I wasn't going to argue with their decision or request reconsideration of their loan denial. Instead, I was going to use their favoritism as motivation to demonstrate what genuine business success looked like when achieved through competence rather than family bailouts. My parents had bet $100,000 on Tony's potential while dismissing my proven track record. Now, I was going to show them exactly what happened when you invested in someone who understood how to turn professional expertise into sustainable wealth rather than just another failure requiring rescue. Within 2 weeks of my family's dinner revelation, I'd secured a $200,000 business loan from a bank that understood the difference between investing in proven success and enabling systematic failure. My business plan, credit history, and practice revenue made me exactly the kind of client that legitimate lenders compete to support. The expansion project I'd designed would add 2 additional physicians to my practice, implement telemedicine capabilities for remote consultations, and establish satellite clinics in underserved communities where my expertise could generate both revenue and genuine social impact. Dr. Martinez, your financial projections are remarkably conservative, my loan officer had observed during our final approval meeting. Based on your current patient growth and referral patterns, we project you'll exceed these revenue targets within 18 months. I prefer to underpromise and overdeliver. My family taught me to be very careful about financial commitments and business planning. The loan approval process had been refreshingly straightforward because I'd provided exactly the kind of documentation that serious business ventures require. Detailed financial statements, market analysis, professional references, and realistic timelines based on actual research rather than optimistic assumptions. Everything Tony had never provided during his various requests for family investment, I'd presented to professional lenders who evaluated business proposals based on merit rather than family guilt and emotional manipulation. Within 3 months, my expanded practice was exceeding every projection I'd shared with the bank. The additional physicians were generating enough revenue to cover their salaries, plus significant profit margins. The telemedicine program was attracting patients from rural areas who'd previously lacked access to specialized care. But the most satisfying element wasn't just the financial success. It was receiving recognition from medical organizations, community health boards, and professional associations that understood the value of expanding healthcare access through innovative business models. Dr. Martinez, your satellite clinic program has become a model for rural healthcare delivery, explained Dr. Patricia Wong from the State Medical Board during a ceremony honoring innovative medical practices. You've demonstrated how professional ambition can serve both business success and community welfare. Professional ambition, it turned out, created outcomes that benefited entire communities rather than just requiring bailouts from retirement savings. My unhealthy prioritization of career was providing medical care to underserved populations while generating sustainable wealth through competent business management. Meanwhile, I maintained careful documentation of Tony's latest venture into real estate development education. The $100,000 investment my parents had provided was being consumed by expensive seminars, coaching programs, and business development courses that promised to teach him skills he could have learned through basic research and community college classes. My family's concern about my ambition was being disproven by every metric that mattered: financial success, professional recognition, community impact, and sustainable growth based on competence rather than family welfare. But I wasn't going to confront them with evidence of my success while they watched Tony's predictable failure. I was going to wait until the contrast between their investment choices became impossible to ignore, then provide them with education about the difference between real achievement and enabled dependency. 6 months after my parents' $100,000 investment in Tony's real estate development breakthrough, his latest venture was following the same trajectory as every previous business opportunity: initial enthusiasm, gradual reality contact, and eventual acknowledgement that success required sustained effort rather than magical thinking. The expensive real estate courses had taught Tony basic concepts about property investment, but implementing those concepts required capital, credit rating, and business acumen that he'd never developed through his pattern of abandoned ventures and family bailouts. "Alexandra, we're worried about Tony," my mother confided during one of her increasingly frequent check-in calls. The real estate program was supposed to provide him with income opportunities, but he's having trouble finding properties that meet the investment criteria he learned about. Real estate investment does require significant due diligence and financial analysis. Has Tony identified specific properties he's evaluating? Well, the properties in our price range don't seem to meet the standards his course instructors recommend. He's learned that successful real estate development requires much more capital than we initially understood. Translation: Tony had discovered that real estate investment required research, financial planning, and sustained effort. Exactly the skills he'd never developed during his pattern of failed ventures and family rescue operations. The real estate market is more competitive than Tony's instructors indicated, my father explained during our next family gathering. He's going to need additional capital to access the kinds of opportunities that provide meaningful returns. How much additional capital? Well, his business coach suggests that serious real estate investment requires at least $250,000 to access properties with genuine development potential. I watched my parents process the reality that their $100,000 investment had purchased Tony expensive education about why he wasn't qualified for the business he'd claimed to understand. Rather than generating income, their support had created awareness of how much more support he'd need to pursue opportunities that remained beyond his competence level. Meanwhile, my medical practice continued expanding with the kind of sustainable growth that my parents had dismissed as too ambitious. The satellite clinics were generating regional recognition for innovative healthcare delivery. The telemedicine program had attracted partnership offers from larger medical organizations. My business loan was being repaid ahead of schedule with profits that exceeded every conservative projection. Dr. Martinez, we'd like to feature your practice expansion as a case study in our business development program, explained the director of the Regional Medical Association. Your model of combining profitable growth with community health impact represents exactly the kind of physician leadership we want to encourage. That's when I realized it was time to provide my family with education about the difference between their investment in Tony's pattern of failure and my achievement through sustained competence and professional ambition. The second family meeting was scheduled 3 months later, ostensibly to discuss Tony's next steps and evaluate family financial priorities. What my parents were actually facing was the inevitable conversation about why their $100,000 investment had produced education rather than income. Tony appeared significantly less confident than during the previous family meeting. His real estate education had apparently taught him enough to understand how unprepared he was for the business he'd claimed to master through weekend seminars and motivational coaching. The real estate market is more complex than the course materials indicated. The properties available in our investment range don't meet the cash flow requirements for sustainable development. I need to reassess my approach. We're concerned about Tony's confidence level, my mother explained. Perhaps he needs more time to develop his skills before pursuing independent real estate ventures. Or perhaps Tony needs to acknowledge that real estate development requires business skills that can't be purchased through expensive seminars and family bailouts. The silence that followed was profound. For the first time in years, someone had stated directly that Tony's pattern of failure might reflect personal incompetence rather than external market conditions or insufficient family support. Tony has now received over $200,000 in family financial support across multiple business ventures over the past decade. Each failure has been followed by explanations about market conditions, timing, or insufficient capital rather than acknowledgement that sustained business success requires skills Tony has never developed. I opened the portfolio I'd prepared with the same thoroughness I applied to complex medical case presentations. Tony's business history, documented failures, and pattern of family dependency, all analyzed with the clinical objectivity I'd learned during medical training. Meanwhile, the medical practice expansion that you dismissed as too ambitious has generated $400,000 in revenue over the past year, while providing healthcare access to underserved communities. My business loan is being repaid ahead of schedule, with profits that support both practice growth and community health initiatives. I presented awards, recognition letters, patient satisfaction surveys, and financial statements that demonstrated exactly what professional ambition could accomplish when applied through competence rather than entitlement. You invested $100,000 in Tony's latest failure, while explaining that my success made me too ambitious for help. What you actually demonstrated was that you'd rather enable incompetence than support achievement, apparently because my professional success didn't align with your expectations about women's priorities. But here's what you failed to understand. Real ambition doesn't require family bailouts because it generates sustainable success through competence. Your concern about my career focus was actually concern that I'd outgrown the need for approval from people who mistake enabling for supporting. The family meeting ended with my parents finally acknowledging that their investment strategy had been based on gender expectations rather than business merit, and that their definition of appropriate ambition had been designed to limit their daughter's success rather than encourage their son's competence. Tony's real estate education had cost them $100,000 and taught him that he wasn't qualified for business ventures that required sustained effort. My medical practice expansion had cost them nothing and demonstrated that professional ambition could create wealth while serving community needs. 2 years after my family's dinner revelation about being too ambitious for help, I was sitting in the boardroom of Martinez Medical Group, reviewing acquisition proposals from hospital systems that wanted to purchase my expanded practice for significantly more than any real estate investment Tony could have imagined. The practice I'd built without family support had grown into a regional medical network employing 47 healthcare professionals and serving over 8,000 patients across multiple clinics. My unhealthy ambition had created sustainable wealth while providing healthcare access that improved entire communities. I'd been invited to speak at medical conferences about innovative practice management, featured in healthcare journals as an example of physician entrepreneurship, and offered board positions with medical organizations that recognized my expertise in combining profitable growth with community health impact. Tony had eventually found employment as a sales representative for the real estate education company that had consumed my parents' $100,000 investment. His income was steady but modest, and he'd moved out of our parents' basement into a rental apartment that reflected the reality of supporting himself through actual work rather than family bailouts. My parents had gradually acknowledged that their concerns about my ambition had been based on outdated expectations about women's professional roles rather than legitimate business analysis. They'd come to understand that Tony's repeated failures weren't bad luck, but predictable consequences of incompetence enabled by family rescue operations. "Alexandra, we owe you an apology," my mother had said during our last family dinner. "We were wrong about your ambition being unhealthy. We were wrong about Tony needing more support than guidance. And we were wrong about what kinds of success deserve family investment." I appreciate that acknowledgement, but the most important lesson isn't about my success. It's about understanding that real support means encouraging competence rather than enabling dependency. I'd also begun dating again, this time attracting partners who were inspired, rather than intimidated by professional success. Men who understood that ambition in women was attractive rather than threatening, and who wanted to build relationships with accomplished partners rather than dependent ones. The family that had gifted my loser brother $100,000 while dismissing my ambition as excessive had learned that investment decisions should be based on competence rather than gender expectations, and that enabling failure was more expensive than supporting success. My parents had thought they were protecting their son while teaching their daughter about appropriate priorities. Instead, they'd provided perfect motivation for demonstrating that real ambition creates sustainable wealth through competence, rather than consuming family resources through incompetence. Sometimes the best revenge isn't proving your family wrong about your limitations. It's proving them wrong about their investment strategy while building something so successful that their approval becomes irrelevant. They'd called me too ambitious for help. I'd used that ambition to build something too successful to need their help. And sometimes the greatest gift a family can give you is the motivation to prove exactly how much they underestimated your potential.